Hi, this is Dr. Bhojraj from VR Spine, and someone just asked me as to types of spine surgeries. So, there are basically a couple of types of spine surgery. The main spine surgery is to release the nerve. As I mentioned, in between the bones of the spine, you have a nerve, and usually people don't come for back pain because everyone has neck pain, back pain. But they come to us or the spine surgeons when a nerve gets compressed this way, because then from the neck a compressed nerve will give arm pain or sometimes even paralysis. If the compression is more severe, then the big nerve gets affected and you could get paralysis of all four limbs. But if the compression of the nerve is only in the back, then only the nerve going to the leg would get affected. So the nerve decompression or release is one of the commonest successful and rewarding operations in spine surgery. The second type of spine surgery is tackling instability. If the bones of the spine come closer and if the disc which is giving the shock absorption and stability is disturbed, then the bone can slip forwards. It is called listhesis. And this can give rise to not only severe pain in the back or the neck, but also traction on the nerve as the bones keep moving. And there we'll have to do a special operation called as a fusion, where we fix. Just as you can have a fracture, you put on a plaster, things could join. But in the spine, if these things are moving and giving rise to traction on the nerve and backache, you may have to fix the spine with some implant like screws, rods, plates, so that the back becomes strong and the pain goes and the nerves are no longer under traction. But the third most complicated surgery in the spine, which is a demanding surgery, is correction of deformity. When the spine is straight as it is supposed to be, then you could have a variation from this, what is called as kyphosis, which means the spine is bent forwards, and scoliosis, which means the spine is bent on one side. So to counteract that, we have to do a surgery which is very extensive, very major, and that where we put an implant and correct the deformity either in this plane or in this plane. That is one of the most complicated surgeries in spine surgery. That is called as correction of deformity, which is correction of scoliosis or kyphosis. This is a very demanding surgery because, as you know, from inside the spine run the big nerves and the small nerves. So in an effort to correct the deformity, you could stretch, damage, pull on those nerves, and you could, in an enthusiasm and aim of correcting deformity, land up with paralysis. So these are very demanding, technically high-tech surgeries, and but they are very rewarding because you could correct and stabilize a crooked child or a crooked person. And that's one surgery which is at the top of the list, not only in expertise, reward, but even high complication rates. So you have to be very well trained to do such surgeries. Thank you.